Hi, everyone, and welcome. My name is Naomi Levy. I am the clinical director here at the People Concern. And today we are joined by some panelists to talk a little bit about administration and distribution of Narcan. So we'll start with introductions. Roxanne, if you'd like to start.
Hey everyone, my name is Roxana. I'm the mental health team lead for C3 Skid Row Red Team, and I've been with the agency for about 2 years and a few months. So that's a little bit about me.
And Roger?
Hi, I'm Roger, case manager with the Red Team. Been here for about a year and a half.
Awesome. So let's get started with talking a little bit about administration of Narcan. Can you guys tell me a little bit? So I guess to give some preface to it, we've had Narcan now at the agency since 2018, and we started administering at that point, but then also in 2020, we expanded to distribution to community members. So clients, community members, whoever wants an overdose bag. And as we're continuing to expand, we thought it'd be helpful to talk a little bit today about administering and distributing. And C3, overarchingly, has done really the vast majority of both here at this agency. So I appreciate you guys joining and giving a little sort of real world context to what this actually in fact looks like. So let's start with administration. Can you tell or share a little bit about some of the signs and symptoms that you see that indicates to you when you're out there that someone is overdosing on an opiate?
Yeah, definitely. I think there's like no direct way that every community member will necessarily present with the same symptoms. But some of the common symptoms that we see is limpness in the body, lack of response, skin discoloration, usually some sort of pale skin. We see small pupils, which is a common symptom in opiate use, as well as shallow breathing and sometimes foaming at the mouth. Something that we also have seen in some cases is folks look like they have a really slow or rapid pulse. So that's definitely one sign and symptom that we've seen out on the streets while outreaching. So those are things to look out for.
Yeah. When you make the decision, sort of after recognizing those symptoms, to administer Narcan, one of the questions that tends to come up quite a bit is, how do I know to administer more? And so I would say on average, what we've seen is that it takes about 1 or 2 doses, but recently in the last month or two, a few months, we've had about a few cases that have felt like outliers. One person, it took about 10 nasal sprays and the other was 9. And so I'm wondering what lets you know in that moment that it's important to keep administering Narcan?
That's a really good question, Naomi. I think these days what we've been seeing out on Skid Row is that there's a new trend of opiates being laced with other drugs, specifically fentanyl and other things that are coming out that are new, which result in needing to administer more Narcan in these situations. Overdosing becoming very difficult to kind of reverse. So in moments like that, when we're doing chest compressions and the person's not really responding, and let's say it takes over 30, 40, 50 chest compressions and the person is still limp, or we don't really hear a pulse, that's a moment indicating that we probably need to administer more Narcan.
Sometimes a response, when it takes over a minute and a half, you kind of say, okay, maybe it's time for another. Sometimes 2 minutes can feel like forever and you see no response. You're used to 1 or 2 working. So sort of have to make that call within, according to how the moment's going and the reaction that the community member might be giving you.
Yeah, another thing, like Roger said, was, if like 1 or 2 minutes are passing by and still it looks like that wasn't enough Narcan, then we go ahead and we administer another dose. And, we have one person probably do chest compressions or whatever the person needs that moment and see if we still see any sort of responsiveness. Obviously, if person still presents the same way, then we keep going ahead. And one thing that Roger was mentioning before when we're talking about this is like a minute feels a lifetime in that situation. So definitely something to note over there.
When you are calling for emergency services, one of the ways that we train is to let dispatch know that the person's not breathing and they're not responding. Has it been your experience that paramedics always come with Narcan? And second, can you talk a little bit about how you've been interfacing with emergency services? What does that look like?
Yeah, I think we've definitely had moments that have been pretty positive, and we've had moments that, need some like maybe more training or areas of growth, particularly with the EMS department. We've had situations where, EMS kind of lags and it takes a while for them to come out, or they're trying to figure out what team to dispatch on Skid Row. And, there's other situations or crises happening. So it's not really prioritized, and overdose isn't really prioritized. So that's why it is essential and crucial in those situations to use keywords of person isn't responding. We don't need to go into detail at that moment and talk about this person's life history or, paraphernalia that's next to them. It's not necessary, because that already triggers a judgment response possibly in the EMS department. And yes, we've seen moments where EMS comes out and there is no Narcan on them, but rather they have other equipment like defibrillators and other things to kind of get the pulse back up and running. So that's some experiences that we've had. Other experiences that we had is EMS is actually very competent. They come out, they're very receptive to engaging with the client or the patient after they wake up and talking to them about what happened. Like, hey, we saw you in this condition. It's really important that right now you don't use in the next few minutes because you're at risk of overdosing again. So we've had a little bit of both, I want to say. But one thing that I have noticed is, of course, EMS can definitely benefit from some training, as we all can in this area.
Yeah, I think one of the experiences that I've had is definitely avoiding the overdose word on when you're calling 911. Mm-hmm. A medical situation where, community member is unresponsive, basically letting them know how they're doing, what they're showing as far as, being cold to the touch, the skin tone, all that stuff is important. And they're going to go over a list. So you need to be patient because they have a list that they need to go over. So it's pretty important to keep calm and give them as much details as possible without, letting them know it's an actual overdose, because they will show up already with that stigmatization towards whomever they are there to tend to. Just another overdose.
Definitely.
When a community member chooses to not go with emergency services, right? Because we, our protocols that we'll definitely be calling, but if the client chooses not to go, it's their choice. What does aftercare look like in that moment? And so how do you handle that? How do you talk about, what to expect with the client once they come to?
Yeah. Aftercare in situations like that involve heavy outreach in those areas. To us as outreach workers or case managers, that kind of signals that, there's a need in this particular area, maybe where a lot of folks are prone to overdose, or maybe there's a new batch of drugs that are out there that are laced with other things. So for us, it kind of signals, more harm reduction supplies to be given out, letting people know that we're not affiliated with, cops or folks that are trying to reduce substance use in the street by having people like sober up. There's no particular goal. Rather, we want folks to know that we're here to outreach, and we're here when it comes to harm reduction methods, and we want to talk to them openly about their substance use and make them feel welcome to share with us like what exactly is happening. We want them to feel safe. So what we like to do is kind of like change things up during outreach. We like to go out with new supplies, talk to them about Narcan. As Roger was saying earlier, like normalizing it, I think, is a very impactful thing to do. And just asking them, like, what has your experiences been like with other providers when it comes to substance use and outreach? Maybe there's a negative experience that has been out there, or folks, don't feel particularly comfortable talking about this. And also at the same time, respecting that, if they don't want to talk about it, it's not personal, and that we'll be back regardless, and we'll be here. And whenever they're ready, we can talk about ways of using safely, or ways of figuring out to prevent overdoses as occurring as often. I don't know, Roger, if there's anything you'd like to add to that.
No, it's everything that Roxana said. It's also a great way to start building rapport with the community around you, so that you get a better sense of where else this has happened. Most of the times, once community members learn to trust you, they'll direct you in the direction of other community members and other sites that need the help, which is a good way of distributing more of what they consider, they call it the miracle drug. So when community members are giving you good feedback about it, once you've opened up the door to normalizing what it's for, it's a good thing. So it's important to approach it in a sense of trying to help them and not, there's some shame into accepting it.
Yeah, not punishing them. I think that's
Yeah,
a big thing.
it's good to let them know that it's for their help. It's good to know that it's good for them to know that you're there to help them safety plan and not judge, because their experiences have been one of shame and one of, getting judgment on them. So once you normalize the conversation of, hey, what's the plan? Who uses first? Who's not gonna use? Who's gonna look out for everybody else? Then that's when you get, they open the doors to you, and you're able to build that community and know who to distribute it to, and know how to talk to them more about being open to using Narcan.
It sounds like it's safe to say that you're both pretty comfortable talking about Narcan with people, right? And their substance use. What are tips that you would give other staff that may not be quite so comfortable approaching the conversation around substance use? How do you pose that conversation with those that you're engaging, just about their substance use in general, potentially, and then also about Narcan?
Bring it up casually in a conversation when you're, conversing with the client. Clients will give you leadways into it. So my leadway when I don't really know a community member is, hey, how do you cope with life out here? What do you do to deal with every day-to-day life? You medicate. And usually that's a clue. That's a leadway for them to say, yeah, man, I use, and they'll tell you exactly what it is that they do. And that's your opening to go for it and offer them, all the help that we offer, as far as, losing the term here, but, just gives you access to safety plan with them. It gives you access to introduce them to programs such as MAT. It gives you access to introduce them to our services as well. So, and then, just basic harm reduction is what they want out here. Once they see that you're there in their best interest, they'll give you all the information that you need. And they'll tell other community members too, and that just opens up doors everywhere for us.
Yeah, another thing I want to add is also consistency to what Roger said. Like being consistent, saying, hey, Fridays at, 9 to 11, we come out here, we outreach, we give supplies. Is there anything you need? Is there like any certain type of gauge needles that you need, any equipment? Yeah. And like being consistent and actually showing up Friday at 9 o'clock.
And learning as to why they prefer certain things. Like one of the biggest things we learned out here is gauges, as far as needles. Mm-hmm. Saw that we delivered on what they requested. It really did open up a lot of doors for us in a very, very dangerous area. Mm-hmm. It basically made us, untouchable in that area to everybody, and kind of like the shot callers of the block kind of forced everybody else to take our help. Mm-hmm. It's cool because they saw that we really weren't there to judge them. We weren't there to, to report on the police side. We were there basically to help them stay safe. And
And it opened up a lot of doors for us too, Roger. Like after that, people came up to us while we weren't even outreaching. Like we were just passing through the quad, and they're like, I want to get COVID tested. I want to get set up with a medical appointment for my abscess wounds. Like it just did a bunch of wonders.
It did, yes.
Yeah.
That the COVID testing was the biggest thing because no one wanted to get that done.
Right.
Definitely.
How have you approached the topic of Narcan bags specifically, so overdose bags? What is sort of your pitch, if you will, when you're talking to folks about them?
You ask them basically if they have any experience with Narcan. A lot of the community members out here have been recently released or have served time in jail, and they do have a video apparently that plays on a loop when they're waiting to get exited, and it shows them how to use it. So a lot of them kind of have some knowledge of how to use it, and a lot of them surprisingly do have plans, like safety plans with their partners or their tent mates that they put in place. So when you present the overdose bag, they're really just interested in the Narcan because that's exactly what they know how to use.
So just in a non-judgmental way, saying like, have you ever heard about
Super.
Narcan?
Yeah,
Let's talk about what that is.
Yeah, and you can't be afraid of like someone, you know, throwing you off or dismissing you from offering it, you know, because at the same time, again, there is some shame involved into accepting Narcan because there is a stigma attached to it that you yourself are a user. But Roxana has also done a good job with other community members of saying, hey, you know, since you don't use, maybe keep an eye out on your community members, on your friends, and you know, you can be that one that saves their lives and feel pretty good about it. That's usually a good leadway into administering Narcan to the community and having them have it on them. So, you know, now we have the issue of they have too much Narcan sometimes, which is a good problem to have.
Roger, you've mentioned safety planning a few times. Can you talk a little bit about what safety planning looks like when you're working with folks that have substance use?
Yeah, in the case of the community members that we've come across is some of them have a plan that one of them will use while the other one stays a lookout, either looking out for other community members trying to steal their stuff or cops coming, or just making sure that they stay awake or that, you know, they're responsive. Another one is, you know, when they both use, you know, let someone, if they're using in a bathroom stall or something, they'll send out a signal, like they'll knock 2 times on the stall. And if there's no response, then to check on the other member. So there's always a plan that community members come up with. And these are things that you learn, the more you talk to them, the more that they'll tell you these things once they learn to trust you.
Another thing that Roger does sometimes is like he's very open to them about like new batches of heroin coming in and other substances, and he tells them like, hey, what's a way, like if this is a new dealer that you're not really familiar with, what's a way that you could test out this new substance without taking it all at once and being at risk of overdose because you don't really know what's in it. So Roger has those conversations with them as well about like ways that, you know, you can use safely and sample a little bit, but not go all out because you don't really know what you're getting yourself into.
Yeah, because it's important that a lot of these guys, especially the guys that are coming out of jail, they have a certain tolerance that they're used to, but they're used to the new stuff that's out there. So it's very important that you let them know, hey, you know, maybe try it a little bit at a time if you don't want to use the testing strips for fentanyl. So be very mindful that a lot of these guys think they can still tolerate the same use that they had before jail, but they won't. And that's usually what leads to overdoses. They think they can still take the same dose and they can't, especially when it's now laced with fentanyl. So you have to approach it as, hey, your stuff is laced. You can't approach it as, you know, your stuff is clean anymore. It's definitely laced. You need to be careful.
Right. Sort of an overarching precaution. These are harm reduction techniques that we talk a lot about in the training. And I'm wondering, other than talking to folks about tolerance and the purity, are there other harm reduction techniques that you guys talk about commonly when you're engaging with folks?
I mean, other than us providing them with clean rigs and, you know, everything that it involves using it, we try to get them wound care kits, everything that we can to get them safety on their own because we don't want them to be shameful of asking for medical help. We do. We basically learn from the clients what it is that they need for safety. But the biggest thing was the wound care kits, it was the clean rigs, it was the clean needles, and learning what they need. So it's still a learning process to learn what it is that the community members need to come up with more of those safety protocols for them.
And telling them, you know, if you want us to like pick up Suboxone or anything for you,
that's huge.
Like we'll go to the medical pharmacy, we'll pick it up for you, let us know what time works, or here's the address to the medical pharmacy, here's like location directions on how to get there. And if you can't go pick it up on the weekend, it's fine. Like we'll check in with you again on Monday and we'll go from there. So kind of just like having open-ended conversations about Suboxone and what, you know, or methadone and what their experiences have been like with that. And then letting them know that we're not pushing it on them, but this is just like something to try out in the longer run if they are interested. And that's where our MAP program kind of comes in. And, you know, we also do take nursing staff out with us to engage folks in regards to like abscess and wound cares and as Roger mentioned, we do give out like wound care kits so that, you know, times that we're not here, maybe at nighttime or on the weekends, people can kind of just like clean up their wounds and things like that. Those are a lot of like harm reduction methods and approaches that we take.
Yeah, the Suboxone
The
is huge.
education.
Yeah, the Suboxone is huge out here, because it helps them when they don't have any money to buy or use. The Suboxone kind of helps to cope with, you know, the feeling of going through the withdrawal, and it keeps them going until they get more money to get something. You know, whether or not they use it or they sell it, just be mindful that if they do sell it, they're saving another life anyways. So don't let that, you know, throw you off from offering it. If you know that a client's going to use it for selling it, that's fine. They're saving someone else's life. That's good. You want to get as much of this stuff out there because these are miracle drugs. These are drugs that help people.
Overarchingly, also the way you're speaking about it, just the tone of the non-judgmental, taking a curiosity approach, taking an open approach and an educational one seems to go a long way. And the fact that you're able to offer harm reduction supplies and services and also overdose bags seems to also set the tone of like, we are an agency and a program that really lives that harm reduction model.
Yeah, you have to normalize it. You can't approach it with, you know, you can't approach it with a sense of fear or a sense of like the unknown. You have to normalize it because this is someone's everyday life. This is someone who depends on this as much as some of us depend on medication. You know, and you just never know where it's going to lead you. Some people, it leads to good places where they do get the help they need. And this is just something that people, you got to meet them where they're at. And you have to, again, overusing the word normalize it. It's the only way you're going to be able to have these conversations openly with the client and get, you know, the information that you need from them and be able to help them.
You also have to be creative, like figure out, you know, maybe if this area is not really receptive to outreach, maybe there's a day that we should go that's different from this day where, you know, there's more folks or newer folks that are coming out and possibly like they're dealers, and we could kind of like scope out the area and see what exactly is happening. Another thing that we've been doing is we've been bringing other members of MAT teams from other programs, and we've been outreaching with them at different times too, just to see like what their experiences are, what they have in harm reduction supplies that maybe we could benefit from. So we do that about one Friday, last Friday of every month. We go out with a new program made by LA County Department of Health Services, which is specifically about opiate use and substance use, and they incorporate MAT as well. So we also try to bring them in and get creative so that, you know, times that we're not here as an outreach team, they have someone to go to on weekends and things like that.
Yeah, and Roxana said it earlier, build some consistency and definitely follow up with what you say you're going to do. They'll appreciate that a lot more. If you say you're going to show up Friday between 9 and 12, show up Friday between 9 and 12 and normalize that schedule with them so that they know to depend on you. Once they do, learn the community that you're with, learn who the shot callers are, because there are those guys. And those are the ones that are going to help you help everybody else, because more times than none, we've noticed that they'll tell you, hey, come back at this time because this is when more of the people are here that need the help. Or, hey,
or they'll tell you right now is not a good time.
Yeah, or they'll tell you straight up, hey, you guys got to go, or don't come back at this time. So, yeah, definitely follow through. Follow up is key. Stay consistent, you know, deliver on what you say you're going to deliver. Don't overpromise anything. Just stay consistent. Consistency is key.
And check in, ask them, hey, you know, we don't work here at night times. We're not here on weekends. Were there any overdoses? What happened? How many Narcans did you use? Do you guys need more Narcan? Things like that. Those questions are miracle questions. And
yeah, and also
like really
exactly
see the community members like open up and be like, oh yeah, there was an overdose here. I don't know. It was someone that wasn't residing on Skid Row. They were new. And it's just like, it opens a lot of doors for communication about it.
Yeah, definitely when they see that you're looking out for them. So one of the things that we do here, we outreach on Friday mornings. We let them know, hey, the weekend's coming up. You guys need some more stuff. So they definitely have that appreciation for it. Then we show up back on Tuesday. And, you know, so it's just staying consistent.
Handle situations where the person denies an interest in having an overdose bag. So, you know, outreach teams or, you know, staff that are working with folks that are housed in project-based or in scattered site might be offering overdose bags in a very non-stigmatizing way, right? Like, this can be for you, this can be for anyone. It's great to have. And folks are like, no, that's not me. I don't need that. How do you then follow up or manage those types of conversations? What are some tips for staff that the client's denying interest?
I think
I mean, it's like any,
yeah,
go ahead, Roxana.
Go.
It's like anything. Not everybody's going to be open to it, just like not everybody's open to help. So you have to meet people where they are. And again, it's the consistency thing. The more you see them, the more you talk to them about it, then the more it'll maybe become normalized in that person's everyday hearing. The more they hear it, you're bound to get someone that says, all right, yeah, sure, I'll take it. So it's just a matter of staying consistent and keep doing what you're doing and keep spreading the message out there. Eventually, you hang out at a barbershop too long, you get a haircut, pretty much.
And I think downstairs staff, property managers or case managers that are stationed on site, having Narcan out in the open, showing that, if there is an overdose, people are equipped to handle it and this is a safe space. I think that in itself sends a big message to tenants and folks that are permanently housed. Also getting creative, like maybe putting some Narcan or some sort of brochure in a welcome kit when someone gets newly housed, things like that. They can go a long way.
Yeah, Roxana can speak to that because she was at an intake at a housing appointment when someone overdosed at one of the, and the management had no idea what to do. So that's definitely awesome if we can get them on board as well to being open to this, because clients go in there. Most people avoid getting housed because they don't want to stop using. And our job isn't to stop them from using or sobering them up. Our job is to help them be housed healthy and safely. So it'd be great to have them also have that kind of knowledge and have access to the Narcan and knowing what it's for, instead of having clients think that they're being judged the moment they move in.
They'll definitely bridge the gap, I think, between providers that are in permanent supportive housing and tenants as well, because there's a disconnect a lot of times when it comes to substance use.
Yeah, a huge disconnect, and there's no trust between the client and the case managers once they move in, and more times than none, that's what leads to failure as well.
Lastly, as our agency is continuing to, administer and distribute Narcan, what are some tips that you have for staff sort of in general that maybe have never done either, right? That have not been, part of an administration, have not distributed an overdose bag yet. What would be some things that you might let them know would be helpful for them?
Oh, I think there's a lot.
Yeah.
One of them that Roger and I were talking about earlier is, number one big tip is to keep calm. Not everything is going to go out the way you planned, especially the first time when you're administering Narcan. As mentioned before, 1 minute is going to feel like 1 hour in the moment, because there's a lot of external stimuli around you. Sometimes you have community members that are coming up to you that are also in panic mode. So you got to figure out how to de-escalate them, de-escalate yourself, de-escalate your teammate, talk to EMS, respond accordingly to the client. So definitely that's one of them, is to keep calm, breathe, whatever you can do in the moment to kind of make you feel more present-minded. It's really hard, but whatever that is, whether it's an image or something that your teammate can tell you in the moment, you got this, even something like that. Definitely those are big helping factors that I want to say. Another thing is to feel comfortable, delegating tasks at that moment and being assertive and telling your team what your needs are. Hey, I need you to call EMS. Hey, put them on speaker. Hey, give me one more Narcan bag. Hey, where's my gloves? Things like that in the moment, and not taking it really personally, and maybe afterwards coming back and kind of debriefing, maybe if your tone was a little too assertive. I know Roger and I have talked about that. We're just I'm sorry. I know it sounded like I was yelling at you. I really wasn't. I just couldn't hear, things like that. Because when you hear 911 coming out and sirens and people yelling, you're not really entirely there when it comes to hearing your tone and how you sound. So delegating tasks and feeling comfortable doing so and communicating about it is also a huge tip.
Yes, just remain calm and always remember that it's not gonna go as planned or as you train.
Mhm.
So, but just remember the basics. That'll help you out. And again, with everything going on around you, be prepared for the negative comments. Be prepared for those things that are gonna make you second guess what you're doing. Trust yourself, trust the training, stay calm. Teamwork is key. And again, like Roxana said, don't take anything in the heat of the moment personal. Everybody has a different kind of reaction, but just make sure that you remain calm. The last thing you need is both of you arguing while someone's overdosing.
Right.
Mm-hmm. And it could stir up even more panic in the community too.
Yes, because you have people there telling you to let them die. That's what they want. You have other people going, save them, save them. And you have other people just basically ranting off on whatever it is. So remain calm, just.
Lots of reactions. Yeah, definitely. And kind of like figuring out, maybe in that moment, like who's going to kind of do crowd control. If you're a bigger team that has witnessed this, like who can probably do crowd control and de-escalate, and provide tools or outreach equipment or engagement tools to whoever's kind of in the surrounding area, who's going to call EMS, and then who's going to actually like administer the Narcan and do chest compressions. So that's definitely something to look out for if you're a team that's bigger than 2.
Any last tips around distributing? Oh, sorry, Roger.
No, just to touch on that one, it'll happen faster than you think, and it'll go slower than you expect. So it'll take forever. But yes, that's all I had to write on that last one.
Thank you. And any last sort of thoughts or tips around distributing overdose bags or Narcan?
We try to incorporate it as much as possible in our like regular outreach routine. We distribute snacks, food, water, and we kind of just like talk to them about our center that opened up, and we kind of just like slip it in there, as Roger mentioned earlier, very casually. Just first time just to gauge, to see the interest of the community members. Is there a trend that we're seeing on the blog? Maybe this blog isn't chronic heroin users, or maybe they have another substance of choice that we kind of need to tailor our engagement tools to. So it's kind of really getting a feel of the quad and bringing it up casually and telling them like, hey, we have these kits. I'm not sure if you've seen it before. Other centers also have it, like the Center for Harm Reduction or the Needle Exchange also has it. We also have it. Maybe you don't want to like walk that far. I just want to let you know that like we come out here on these days and we can bring it to you. We can supply you with it. So yeah, I don't know.
And if all else fails, there's always the no questions asked approach. If they need it, we can figure out all the administrative part on our end. But some people just really, it's the don't ask, don't tell thing. If you need it, we won't ask you anything else other than that. So always be open to that as well.
Yeah. And also like telling them it's okay if you don't want to talk to me about it. I understand. It's okay. If they're like, no, I don't need that. I don't use that. And it's like, that's all right. I'm just letting you know, like, if you ever know someone that does use, this is an option. We carry it and we're here in case you need it. And sometimes like you might go back out there and they're like, oh yeah, this actually happened. I have this friend, but really no, it's not a friend, but that's okay. That, had this situation. And we're like, okay, that's our in.
Yeah, always leave the door open. If they say no the first time, just say, hey, you see me around, just don't be afraid to approach me and ask me for some. If it's for you, if it's for a friend, or you hear someone else needs it, just, ask me and you'll get it. Or you can go to the center and get it there. Always leave it open that, hey, you can take it anytime. You just, not whenever I ask.
Yeah, I think the goal isn't to always like make sure they have the, Narcan OD bag. Like that's not the goal always for us as outreach, is to make sure that they know that we're approachable. I think that's a big goal, that like these guys are safe. I can go to them when I want to talk about this. It doesn't have to necessarily be about talking about getting Narcan or getting extra Narcan, but just talking about substance use in general. Maybe there's like other substances of choice. So we want to leave the door open for that too. Or maybe mixing substances is something that they're partaking in. So we also want to leave that door open.
Yeah, we went from being known as like the housing people to like the medical people now. So it's a real cool thing. So, you want to build that trust that, you're not just a one-trick pony. You're here for multiple services, and that's actually the point. So it's pretty, and again, the best tool you have is your own clients, your own current clients. Ask them about their environment. Ask them about their surrounding community. They'll give you that information. If you have that good rapport with them, if you have that trust with them, they'll lead you to the people who need the help. They're your biggest asset. They're your biggest tool. They're your biggest informant.
Yeah, that's very true.
Well, on behalf of the agency and the program, I want to say thank you for the incredible work that you guys are doing out there. It's literally life-saving. So thank you. And thank you for taking the time today. Truly, truly appreciate all of the information and wisdom that you're bestowing. It's greatly appreciated. So thank you so much.
Starting this program now, we know you're.
Yeah, thank you.
Okay.
This is your baby, basically. So
couldn't do it without you guys, truly.
Well, thank you for making this available for all
Yeah.
of you and for the community members.
Yeah, thanks you guys.
Impact.
Yes.
Thank you. Thank you for everything. Well, have a great rest of your day, guys. I appreciate it.
Likewise. Stay
Okay.
safe.
See ya.
Bye.